Thank you for joining us. I'm Linda Riley. I'm the administrator here at Saddleback Eye Center, and we're with the LASIK Insights with Dr. Manger. And today, Dr. Manger, I'd like to talk to you about 5 steps to choosing a LASIK surgeon that's right for you. So you've been specializing in LASIK for 17 years. This is all that you do, 5 days a week, 50 weeks a year. So what piece of advice would you give to patients?
Well, I think it's important that you find somebody who truly specializes in LASIK surgery and is not doing cataract surgery and eyelids and glaucoma work. That LASIK surgeon should have performed at least 50,000 LASIK procedures and be able to provide you a documented success rate for their patients. And probably the most important factor that I would look for is find a LASIK specialist that has one office and practices in only one location.
And I think that that's a great point, because a lot of times patients don't understand the difference between doctors with multiple offices. They're kind of spread too thin, and really what happens most often is that the doctor's spending all their time driving between offices as opposed to doing surgery.
Well, that's right. And what happens is they also have their technology spread out amongst multiple offices. Here at Saddleback Eye Center in Orange County, California, we have one office, one location, one specialty, and I do all the LASIK surgeries. It gives us the opportunity to have precise attention to detail and give our patients superior results, which they certainly deserve.
And I think it's important, too, that you're always available for your patients every day. I know that we see a lot of patients and they say, you know what, I've been looking for LASIK. I've gone to a few different LASIK offices in Orange County, and this is the first place that I came to, and they actually met the surgeon when they come in for the exam here with you. We actually had a patient who told us just the other day she went to an office and they only did about 3 different tests on her eyes. And I asked her, I said, well, did you meet the surgeon? And she gave me an answer I hadn't heard before. She said, oh, no. She said, but they pointed to a picture on the wall and they said, well, that's the person doing your surgery. I mean, that just doesn't seem right to me.
Yes, the patient really deserves the attention of the surgeon that they're going to trust their eyes to. Here at Saddleback Eye Center, our patients deserve the personal attention of the surgeon, and I would think most people would really prefer to have it that way.
And now you've done over 70,000 documented LASIK procedures, Dr. Manger, and patients a lot of times they'll ask me, well, what's the importance of the 70,000 documented procedures? So can you explain a little bit about what that means?
Well, I think a lot of times the information provided may not be exactly true, and we've just always stressed, I've always stressed to my staff here at Saddleback Eye Center that honesty is our #1 priority.
I know, and sometimes it's difficult for patients to really be able to tell, because they'll see ads in the paper or they'll hear ads on the radio, and someone will say they've done 50,000 and someone else will say 100,000 or 200,000, and it's really hard sometimes for people to be able to tell the difference.
I have a Pendaflex files in the credenza in my office that documents the names and the dates of all the LASIK surgeries I've done over the last 17 years, and by this time that's a fairly large file, but it's available to anybody who would question that.
And I think another nice thing with you doing the surgery, Dr. Manger, is patients tell us all the time how comfortable they are in your care. And even though you've done 70,000 LASIK procedures, you still take that time with each and every patient, and they really appreciate that personal care that they get directly from you.
Well, we truly enjoy taking care of our patients before LASIK, where I examine all the patients, during the LASIK, and I'm the only surgeon there, and after the LASIK surgery. And we certainly are not the LASIK office where the patient needs to go to another doctor for their postoperative care after the LASIK procedure is performed.
I know that people are naturally attracted to low prices, but I think what they don't necessarily understand is that if they go to a budget center, they're cutting corners in a lot of ways that just are not obvious to the patient.
Well, I think you really are, because a lot of times you're going to have a surgeon who may be inexperienced or maybe worked in multiple offices in the California area over a period of years. They may, at these offices, they may be using the older technology. For instance, they might use a metal keratome at times instead of the interlace technology, and we don't use the older technology anymore. They may have limited diagnostic equipment, and they may give you extra charges for post-operative care, for eye drops they give you following the surgery, for an enhancement might cost you extra, or sometimes there's upgrades in technology. In other words, they give you a low price, but if you want to pay $500 or $1,000 more, you can have the better technology. We truly believe that every eye deserves the best technology. We're not willing to use the older technology on anybody.
Right. So in other words, you might be paying for LASIK in more ways than one at a budget center.
There was a review by Congress in 2006 where they reviewed the entire LASIK industry, and they focused one of their studies on budget centers where LASIK is done for $3,000 or less. And what they found is 1 out of every 6 of the patients that go to a budget center are truly unhappy with their vision, and that's just really an unacceptable statistic. The cheap price is something that I think that is an easy way for some surgeons to attract patients, because money is the easiest thing to understand. People understand the difference between $1 and $2. But my advice here is make sure you educate yourself as much as possible, because you're going to find out a lot of information and a lot of reasons why you should go to a quality LASIK center rather than a budget center. If I'm going to offer quality surgery, I'm going to use the best technology, the best staff, the best equipment that can be used to give every one of my patients the best vision possible. I'm just not willing to use anything less in order to get the charges down to $3,000.
How does the patient know that? I mean, what are things that maybe they should look for when they go into an office?
Well, I think the first thing, other than meeting the surgeon at the time of the exam, because that's huge that they meet the surgeon and the surgeon tells them whether they're a good candidate for LASIK or not, but there should be an extensive exam to get all the details, and that usually involves a 14-step LASIK exam, and the staff and the doctor should be available and eager to answer any and all of your questions so you can feel comfortable about your LASIK decision.
Isn't it ultimately the surgeon's experience and judgment that makes the difference? I mean, to me, it doesn't make sense that it would be the laser.
Well, I would point out that we have the most advanced technology. We have one of the only centers that has both the VISIX and the Allegretto laser, and sometimes it's better to use the VISIX, sometimes it's better to use the Allegretto, but they're both great lasers and have been used for many, many years and are recognized as the quality LASIK lasers in this industry. The important part of the decision is the surgeon you go to, because honestly, there are 20 to 30 decisions that have to be made in every single LASIK eye. And it's important that there's experience, great judgment, and that's going to make the difference in the vision that you get from your surgeon.